everyone. I am Dr. Ramana Prasad, Senior Consultant Pulmonologist, KIMS Hospital, Secunderabad. Today is World Tuberculosis Day, which is celebrated all over the world. On this occasion, I will be talking about tuberculosis. All of us know about the term tuberculosis. Tuberculosis is still a big taboo in our society. If a patient comes and if we diagnose him as having a tuberculosis, then they will be taken back. Then they'll start telling, we don't have any previous history, none of the family members had any TB, then how am I going to get it? And how is the diagnosis of TB is made like that? So all these things are there in the day-to-day practice. So why World Tuberculosis Day is celebrated? So in 1882, a scientist by name Robert Cox, who discovered Mycobacterium tuberculosis as the causative agent, causative organism for tuberculosis disease, announced to the world that this is the reason for tuberculosis, which actually opened up the doors for TB treatment. So to improve the tuberculosis treatment outcomes, to increase the awareness, every year March 24th is celebrated as World Tuberculosis Day. Now we'll come to discuss about tuberculosis. What is tuberculosis? So we know tuberculosis is a contagious disease, a dreadful disease. Tuberculosis, as I already told you, is caused by Mycobacterium tuberculosis, a bacteria, and this spreads from person to person by droplet route. So whenever a person who is already infected with tuberculosis either sneezes, either coughs or speaks, talks, lot of TB bacteria will be coming into the atmosphere in the droplet form, and the people near that infected person, if they inhale those organisms, those people will be infected with tuberculosis. So this is how tuberculosis spreads from person to person. That's why it is very highly contagious disease. So if you see who are the people who will be getting affected with tuberculosis. So normally children and elderly people who will be having very less immunity are prone to develop tuberculosis. At the same time, people who have chronic diseases like chronic lung disorders like COPD, asthma, bronchiectasis, interstitial lung disease, where immunity will be very low in these people. People suffering with chronic kidney disease, chronic liver disease like cirrhosis. At the same time, people particularly having uncontrolled diabetes, people who are suffering with connective tissue disorders like rheumatoid arthritis, sarcoidosis, SLE, and lupus, systemic sclerosis, who are on immunomodulators or immunosuppression treatment. At the same time, people who are having AIDS or HIV infection, where resistance power is very low, and some people who had kidney transplantation or liver transplantation, who are on regular immunosuppression, where the immunity power is very less in these people, are prone to develop tuberculosis infection. And all of us know for the last 2 years, we are facing COVID pandemic. And all of us know again, the COVID treatment includes steroids. It could be either oral steroids or intravenous steroids. So intravenous or oral steroids over a period of time, if they were given on continuous basis, they cause decrease in the immunity. So now we are seeing a lot of new patients developing tuberculosis who were previously affected by COVID and who were kept on steroids. So if we see what are the symptoms that are seen in the tuberculosis, before going to that, we should know the types of tuberculosis. There are 2 types of tuberculosis depending on the infection, that is primary infection. The second one is secondary tuberculosis. In the primary tuberculosis, as I previously mentioned, it is an airborne disease through droplet infection. When an infected person coughs, sneezes, or speaks, talks, lot of TB bacteria will be coming into the atmosphere. The other person who got exposed to this infected person, when he inhales, these TB bacteria will be going into his lungs. But that may not turn into an infection or a disease. This is called as primary TB. Secondary TB is where there is reinfection or reactivation of the existing TB bacteria in the body. So which exactly causes disease? Tuberculosis is a disease depending upon the organ that is affected. So coming to the different category of types of TB, there are two types. One is pulmonary tuberculosis, the other one extrapulmonary tuberculosis. All of us know tuberculosis very commonly affects the lungs. So when the lungs are affected, it is called as pulmonary tuberculosis. Apart from lungs, if any other organ is involved, that is called as extrapulmonary tuberculosis. In extrapulmonary tuberculosis, lymph nodes, either in the neck region, cervical region, in the mediastinum or in the abdomen, they can be infected with tuberculosis. And spine, bones, surrounding the heart, there is a layer called as pericardium, and surrounding the lungs, there is a layer called as pleura, and brain and peritoneal surfaces and the genitourinary system. These are the common extrapulmonary places where tuberculosis can develop. So depending upon the organ involved, the symptoms will vary. As we know that tuberculosis is very common in lungs, that is pulmonary tuberculosis. The symptoms are chronic cough. Initially, it could be very dry cough, followed by lot of sputum production. There will be evening rise of temperature, loss of weight, loss of appetite, lethargy, anorexic, and people will be losing a lot of weight in a short span of period. So these are the common symptoms of lung involvement. Sometimes in the sputum, there can be blood also. It is called as hemoptysis. So, and all these symptoms varies depending upon the severity of the lung involvement. In the initial stages, there may not be much symptoms, but as the disease progresses, as the disease causes lung damage, the symptoms will be much more, causing breathing difficulty, cough with sputum and temperature, loss of weight and loss of appetite. And in the case of extrapulmonary tuberculosis, all the symptoms depends on the organs that are involved. In the mediastinal lymphadenopathy, because of the compression effect on the airways, the patient can have severe dry cough. That may be the only symptom. There may not be any fever, there may not be any loss of weight and appetite. In the genitourinary system, so recurrent urinary tract infections, sterile pyuria, even we send the urine for so many cultures, most of the times it comes as sterile only, no organism can be isolated. And in young females, after marriage, the tuberculosis in the uterus, that is endometrial tuberculosis, could be one of the main reasons for the infertility. Infertility can be primary or secondary. So people who have brain tuberculosis, like tuberculosis in the brain or meningitis, TB meningitis, they have different types of presentations like seizures, giddiness, loss of consciousness, high-grade temperature. These are the common symptoms that are associated with brain tuberculosis. So like that, what are the organs that are involved? The symptoms will change and they vary from site to site. So once we have this suspicion of tuberculosis, then how to diagnose it? So diagnosing tuberculosis is very common and at the same time very difficult also. In the pulmonary tuberculosis, as the patient is having a lot of sputum production, if we send that sputum for ALV staining or gene expert test, if they can visualize the TB bacteria under the microscope, then it is 100% confirmed that patient is having tuberculosis and we can straight away start the anti-TB treatment. But it may not be that easy. People who doesn't have sputum production, but all the symptoms, like I said, cough, mostly dry cough, evening rise of temperature, loss of weight and loss of appetite. When we take a X-ray or CT scan, definitely we will see lung changes, lung shadows, lung infiltrates. So most of them point towards tuberculosis. But as we need to have a confirmation, we need to do a procedure called as bronchoscopy. Bronchoscopy is an endoscopic procedure. We go into the airway and go to the place where lungs are infected, wash that area, remove those secretions and send it for analysis. In that analysis, again, if we see TB bacteria under microscope, then the diagnosis is confirmed. So in other forms of tuberculosis, like extrapulmonary tuberculosis, people who have cervical lymphadenopathy or who have mediastinal lymphadenopathy or who have abdominal lymph node involvement, we need to go to that place and do a biopsy. So cervical lymph nodes, it is very easy to do biopsy. Either it is direct excision biopsy or sometimes you can do fine needle aspiration cytology, but biopsy is the preferred one. Where the mediastinal lymph nodes are involved, then we have to do a procedure called as EBUS TBN, endobronchial ultrasound transbronchial needle aspiration. So in that, again, we put a bronchoscope inside, which will have a telescope, like a small microscope. We'll be putting that into the airway, and we can visualize the enlarged mediastinal lymph nodes. And exactly to that point, we can go and put a needle inside and do aspiration. That is EBUS TBNA. Once this aspirate is sent for analysis, again under microscope, if they can find out TB organism, then the diagnosis is confirmed. But sometimes it becomes very difficult to diagnose tuberculosis. Then we may have to do a lung biopsy or cryolung biopsy to confirm the diagnosis, because there are so many other diseases which can mimic tuberculosis, like connective tissue disorders, vaginous granulomatosis, sarcoidosis, sometimes SLE. These things can mimic like, sometimes even lung cancers also, they can mimic like tuberculosis. So coming to a proper diagnosis is very important. So in that situation, we need to use all the techniques to come to a conclusion and to give a proper diagnosis to the patient. Once patient is confirmed of having tuberculosis, then the treatment will start. As I previously said, lung covering, which is pleura, can have tuberculosis. So where there will be accumulation of the fluid leading to pleural effusion. So in that situation, patient will be having pain on that side where lung is involved, and there can be breathing difficulty also. So the pleural effusion can be identified by doing a chest X-ray followed by ultrasound. And once we remove that fluid, it may give conclusive evidence. But if the evidence is not conclusive, then we may have to prove or disprove the diagnosis of tuberculosis by doing a thoracoscopy. Thoracoscopy is a laparoscopic procedure where we will be making a small incision onto the chest where the infection is there. We'll put a laparoscope instrument into the pleural cavity, and under vision we can see what are the things happening inside that pleural cavity. If there are any nodules are there, we can take a biopsy, and the fluid that is there can be drained. And once we send this biopsy for histopathological examination, most probably we'll come to a diagnosis. It could be tuberculosis or some other disease which is the root cause for this fluid accumulation. Same thing can happen in the peritoneal cavity also. So there also the biopsy can be taken. So the diagnosis is very important for tuberculosis. Why? Because previously the tuberculosis treatment was very simple. So we have only 4 drugs, and those 4 drugs used to completely cure the tuberculosis infection. But as the Mycobacterium tuberculosis started developing resistant to the existing anti-tuberculosis treatment, and now we are facing a problem of drug-resistant tuberculosis. So it is very important to prove the diagnosis of tuberculosis, and at the same time, it is the doctor's duty to confirm whether it is a drug-sensitive tuberculosis or a drug-resistant tuberculosis. So for that, the very easy test, as I previously told you, is gene expert test or a CBNAT test or TB culture. In this, we can clearly identify whether it is a drug-sensitive bacteria or drug-resistant bacteria. So this is regarding the diagnosis. So coming into the treatment, as I told you, the treating tuberculosis is very easy. At the same time, very difficult for the patient to follow the treatment, because it is not 1 or 2 days of treatment. It is minimum 6 months of duration. So as I said, depending upon the organ involved, depending upon the place where the infection is, the treatment will change. In general, if the lungs are involved, the treatment is for 6 months. If it is drug sensitive tuberculosis, all other organs, when they are involved or infected by tuberculosis, which is called as extrapulmonary tuberculosis, the treatment may vary from 9 months to 18 months. So if the spinal cord or bones are involved, the treatment can go up to 18 months. So if it is a proven case of drug-sensitive tuberculosis, initially 4 drugs, INH, rifampicin, ethambutol and pyrazinamide will be started, and the drugs will be continued for the first 2 months, which is called as intensive phase. Once the patient completes 2 months of intensive phase, then pyrazinamide will be removed from the treatment. The remaining 3 medicines will be continued for the next, can say 4 months in pulmonary tuberculosis as a maintenance dosage. So if the bacterium is drug resistant, then we need to prove what are the drugs that are resistant to, what are the drugs that are not working on this tuberculosis bacteria. So that is possible through culture. So once we have the culture report with us, then we need to change the medication according to the culture sensitive report. This is called as drug resistant tuberculosis. So where we need to give second line TB drugs so as to kill the bacteria. So in general, second line treatment for drug resistant tuberculosis will be for 18 months. So the initial 6 months period, all the drugs will be there, and the remaining 1 year, a few drugs will be there. So if you are starting with 5 new drugs, the 5 drugs will be continued for the 6 months, and 2 drugs will be stopped, remaining 3 drugs will be continued for the remaining 1 year. So here the biggest problem is most of these drugs are either nephrotoxic or hepatotoxic. So we need to follow these people very carefully. So these people on ATT, either first line ATT or second line anti-tuberculosis treatment, can develop hepatotoxicity. That means they can, at any point of time, can develop jaundice. So which is drug induced. That is why for the first 2 months, we need to regularly monitor them through their liver function test. So if they are tolerating the anti-tuberculosis treatment well, then after 2 months, not much problems are expected. As these drugs have hepatotoxicity and nephrotoxicity, so the liver functions and the kidney functions to be monitored frequently. At the same time, at the time of starting the medication itself, the common side effects or common complications that are expected with the anti-tuberculosis treatment will be explained to them. So people with anti-TB treatment, some people can have allergic reactions, itching and rashes all over the body. Some people have severe joint pains, could be because of elevated uric acid levels. Some people can have blurring of vision as a side effect from the ethambutol, which has ocular toxicity. And most of these drugs can cause gastritis. So all these things will be clearly explained to the patient before starting the treatment, and they were instructed to come back to the treating physician when they observe some of these side effects. If everything is fine, if the liver function tests are absolutely normal, no evidence of any side effects, so first 2 months we will be continuing with the 4 drugs, then followed by tapering doses of drugs for the next 6 months in case of pulmonary tuberculosis. And depending upon the organ involved, the treatment will vary from 9 months to 18 months. So these are the precautions to be taken by the patient. At the same time, these people were asked to come back to the treating doctor frequently to see whether these people are regularly using the medication or not. That is why some people cannot come from faraway places. That is why we have a DOTS program, directly observed treatment where the technicians or the nurses or the people who are in that organization will be observing the patient directly whether they are taking the medicines or not, and they will be having a frequent visits to the patient home, and or they may be asking the patient to come back for a review to check whether these people are taking the medicines on a regular basis or not. That is DOTS treatment, which in general is very helpful for patient compliance. But still we face a lot of issues with the drug treatment, because as it is a long-term treatment, as I told you, the initial 2 months is very important. So that's why it is called as intensive phase. Most of the symptoms like cough, fever, the sputum production, the decreased appetite, everything will abolish during this 2 months, and the patient start feeling much better. So that gives a false impression to the patient that everything is fine with them. So some of the patients tend to stop the medications once they feel that their health is back to normal. So this causes a discontinuation of the treatment, leading to drug default, which again leads to drug resistance. So once these people doesn't continue the treatment as prescribed, over a period of time, they can develop drug-resistant tuberculosis, which causes so many problems in their body. So again, which leads to taking second-line drugs for the next 18 months. So this is a big social hazard because of the non-compliant patients. As we know, tuberculosis is a contagious disease. If we have more number of drug-resistant cases or drug-resistant patients in the society, they will be spreading this drug-resistant disease to normal people who are in the society, which will make them contract the drug-resistant tuberculosis. So that is why the monitoring is very important, and we need to follow up the patients frequently to see whether these people are taking the drugs properly or not. Frequent counseling is also very important to counsel them about the development of drug resistance tuberculosis if they doesn't take the medicines properly. So these are some of the general issues what we'll be facing in the treatment of the tuberculosis. Once the tuberculosis disease is completely cured, most of the patients may not get this disease back, but people who are already on immunocompromised status or immune suppressive medications, there is a possibility they may get it back in the future. So the post-tuberculosis complications are there, but they completely dependent on the severity of the disease. Particularly, the complications we will see in the pulmonary tuberculosis only. And in sometimes extrapulmonary tuberculosis patients also. If the patients gets delayed in going to the doctor, and if there is a delay in identifying the disease, by that there will be a lot of damage to the organs, particularly in the pulmonary tuberculosis. Once the lungs gets damaged, in some people there may be complete recovery, some people there may be scar formation in the lungs. So we'll be seeing a lot of patients with post-tubercular bronchiectasis, where there will be a lot of scars and a lot of holes in the lungs, though there is no fresh tuberculosis disease in them, but the lung damage will be causing them repeated respiratory tract infections. At the same time, these lot of scars that were there over a period of time can get converted into, can transformed into lung malignancy also. So these people should be monitored for their life for these type of complications. In young people, if the lung involvement is very severe, sometimes there can be airway involvement causing narrowing up of the airways, leading to the tracheal stenosis. So this is a very serious complication, particularly in the young age group, where there will be narrowing up of the airway, the main airway or the subsequent small airways, leading to the breathing difficulties. So this has to be identified by doing a bronchoscopy. and that needs to be taken care by doing dilatation or by putting a stent either temporarily or permanently. So that is one of the major complication of tuberculosis infection. So the most important aspect of tuberculosis treatment is treating the other comorbidities. As I said, uncontrolled diabetes is a big trigger for developing tuberculosis. So the diabetes people should be keeping their sugars under control so that their immunity won't be low, which in turn can lead to tuberculosis infection in the organs, particularly lungs. So keeping sugars under control is very, very important for the normal people in preventing the tuberculosis, and at the same time, people who are already on anti-tuberculosis treatment should keep their sugars under control. And people who continues to smoke are requested or they are made to quit the smoking, as the smoking increases the lung damage and it causes more problem in the treating the tuberculosis. The tuberculosis infection may be coming down, but at the same time they may be developing chronic bronchitis or COPD, which later causes severe breathing disorders and respiratory issues for the patients who continues to smoke. And people who are alcoholics, so they were asked to quit alcohol because all these anti-tuberculosis drugs, as I told you, are hepatotoxic. They can cause liver damage leading to jaundice. Once these patients who are on ATT develop jaundice, then we may have to discontinue the treatment till their liver functions or liver enzymes become normal. So again, there will be disruption in the treatment, which can lead to development of drug resistance. So this is in a nutshell about the tuberculosis disease. So who are prone to get infected with the tuberculosis, and what are the types of tuberculosis infections, what are the symptoms, and how to diagnose the tuberculosis infection, and how to follow up with the patients regarding their treatment. And as I told you, quitting smoking, leaving alcohol, and taking proper healthy diet is very important for the people who are on anti-tuberculosis treatment. So today being the World Tuberculosis Day, so this is the time where we need to educate more people regarding tuberculosis, how it comes, how it damages the organs, and what are the diagnostic facilities that are available, and how easy it to treat tuberculosis, and how difficult it becomes if they doesn't follow the doctor's treatment, if they stop abruptly in between the development of drug-resistant tuberculosis, which can be fatal to their life. So these are some of the things which will be propagated throughout the world on this day. So today being the World Tuberculosis Day, so I request all the people to be very careful about their lung health, particularly people who smoke and people who have chronic diseases, diabetes and other chronic diseases, lung diseases, liver diseases, kidney diseases, and who are on immunosuppression medication, to be careful about the development of tuberculosis. And if there are any symptoms, like as I told you, it is always better to consult the specialist doctor so that the disease can be identified at an early stage and it can be treated and cured completely.